We're going to be having a vaccine drive-through center at the fairgrounds. We'll have 4 tents. We'll be able to do 4 cars at a time. Part of the process, I'm sure people, it's all in the news every day. Once people get their shots, we have to have a waiting area. We have a designated waiting area. When you enter the fairgrounds by South River Street, everything first off is by appointment. We use the sophisticated software that the Commonwealth will give us and prep mod, and people will need to go and schedule their appointments. Everything's by appointment, and that really is so that you can control how things are going. Then people will arrive at the fairgrounds. They'll come to the first booth. First booth, just like if you go into a building today, they do the screening. You know, are you on the appointment list? Do you have a fever? Have you been in contact? They do the, you know, the normal screening for COVID. Then you go up to the second booth. Where they'll ask you some more questions. They'll give you information on the shot itself. They'll talk to you a little bit what to expect. Then you will be directed by volunteers to which of the 4 tents that you'll pull up to. Tents will be set up. There'll be 2 20 by 20 tents with a tent in between. The 20 by 20s will have sides. The smaller tent between the two is really for the office, for the medical personnel to sit, to have their workbook and to have the medication, et cetera, because remember, it's outside, so we have to have a heated area for folks. People will be coming in their cars. We'll have 2 sets of those. People will get their shots. Prior to all this, we're going to have a very robust web system to go along with PrepMod to really tell people what's expected. The next step is they'll have the shot. Once they have the shot, they'll pull over to a waiting area. There'll be an outside waiting area. We're going to have an ambulance with paramedic staff there on site. We'll have volunteers on the ground. We'll have signage. If people start to feel sick, they lean on their horn so that they can get medical attention. If, God forbid, someone's having a severe reaction, they need to be transported to the hospital. That ambulance that's on site will transport them. Another ambulance will come over from across the street and take that post and stay there. And we'll repeat this during the day from 9 to 5, 6 days a week, Monday through Saturday, right through June 30th. And then more than likely we'll have to go beyond that. The big thing is having the appropriate medical personnel to administer the shots. We're very fortunate. Our paramedics can do that on any given day. We'll probably have, 35 to 36 paramedics that could be available to give out the shots, as well as volunteers. One of the big things people ask is, how can I volunteer? For the last week or so, I've been getting a number of emails. I know that the selectmen have been getting emails. The Board of Health's been getting, Kathleen said the phone's ringing off the wall with people wanting to know when they can get their shot and also how they can participate. There is a organization called the Medical Reserve Corps. Anyone that wants to volunteer, including myself, I signed up. This is what the form looks like. You can go onto our website. We have the Medical Reserve Corps application there. Tells you all about it. It's actually, we're in the Duxbury Bay area region, and that takes in Marshfield, Pembroke, Canson, a number of communities. But if you want to volunteer as a medical person, you want to volunteer as a non-medical person, you need to fill out the application. There's Corey paperwork there. All the necessary paperwork is on the website. We have a box that people can click on. They can go to the Board of Health. They can go to the Board of Selectmen. Then there's the volunteer application. You have to submit your driver's license and whatever other pertinent information that they request. They'll process that and then get you in the Medical Reserve Corps. If you're a medical person, as a medical person. If you're a non-medical person, as a non-medical person. We still have some things to do. We've got to get the software first and foremost. We got to make arrangements to get the medication. Dr. Irons, who's overseeing the program for us. We're going to be meeting tomorrow to talk about working with, I need to call Jenna Ferguson back to make arrangements to get our medication out, depending on how much they're going to be able to send us. We can store quite a bit. What they can send us will dictate how many people we can get in the prep mode right away. People can sign and register. People may have seen today, I know the senator is very much aware of this and the Board of Health, but the governor during his press conference today moved up seniors. They're now in phase 1. We'll have to get the updated chart for those folks that are in phase 1. Even though we have the medication, you still have to follow the guidelines of who's entitled to get that particular medication.
There will be an attestation form that you have to complete, where you will designate, your comorbidities or your eligibility. Do they mandate documentation from your physician or a letter? No, it's just going to be an attestation form. What she was talking about is, they still have not completed vaccinating people under phase 1. So those people will take priority. And again, based on their attestation, completion of the form, their eligibility will then be determined, and they'll be able to make their appointments in a timely fashion. But no formal proof documentation as to what your health conditions are going to be required.
Okay, Mr. Chairman, what you will have to do is that day that you show up, you will have to have some type of identification to show that you are the person.
Personal identification, yes.
That has your.
First off, just congratulations to Mike and his team for putting that all together. I know that this is logistically challenging when it comes to the cold storage, the observation, the software, and obviously the procurement of the vaccine from the federal government. This is a really challenging logistical operation. So very good job to everybody involved, Kathleen, Michael, Chief Hocking, everybody, really. So one of the biggest concerns and questions that we're getting right now to our office is the map that they put up last week showing the vaccination sites throughout the entire state and how the South Shore is very bare. The governor basically wanted to get the site up as quickly as possible, and it's about 1/3 of the vaccination sites that will be live within the next week or so. And one of the, they started out with 44 sites, most of which are partnerships between Walgreens and CVS and more low access or low income communities. And so as we continue the further rollout of these vaccination sites, and there's going to be 59 vaccination sites that are going to be released this week, and then 165 vaccination sites by middle of February, that's going to be able to cover the South Shore. And South Shore Hospital right now is going through the process of becoming a vaccine depot, which will allow them to do vaccinations on a much larger scale and actually go out into areas of vulnerable and critical needs in all sorts of communities throughout the South Shore and make sure that those people have access to the vaccine. I was on a call with South Shore last week, and I was very encouraged after seeing the map and seeing the South Shore not having any stars on that map right now, and then talking with DPH and talking with South Shore. This is all more of just we wanted to get a map up as quickly as possible so people could see where they are, and that we're going through the process at a state level of certifying all of these sites by doing all the things that Michael just outlined, all the steps that we have to take to make sure that we comply with the federal mandates and standards that are there, as well as we make sure that none of these vaccines are going to waste. And one of the things that I did hear from South Shore Hospital is actually, it's great that you're getting the Pfizer vaccine, because not everyone can get that vaccine, as it has to be in a lower cold storage. So that's actually going to be a benefit, in my opinion, to the town of Marshfield, where more people will have access and demand will be more for the Moderna vaccine than the Pfizer, because not everyone has that equipment. So kudos to everyone involved in this. I know in talking with Michael about a week and a half ago, he had spoken about the town getting the cold storage during a Chamber of Commerce meeting, and really Marshfield's ahead of the game when it comes to this. And to be able to do this on your own without a pharmacy partner is very impressive. And I know that a lot of concern has been raised about the deployment of the vaccine and the vaccine distribution sites and the access to the vaccine and the phasing of the vaccine. I feel your frustration. We've worked very closely with DPH and with the governor's office to try and get as many people and professions boosted up as quickly as possible. And I'm really glad to hear the news today that the next step, which we'll be moving into on the 1st of February, will include our elderly population over the age of 75. And then from there, we'll be able to start individuals with 2 or more comorbidities, as well as individuals 65 and plus. So it's really good news that we're listening to more to the CDC guidelines when it comes to individuals who are 65 and older. And again, just a really job well done by the town of Marshfield all around in making this happen. And please, continue to use our office as a resource as we move forward with this. But the delivery sites the vaccination sites are coming, and and we're fast tracking a lot of people in these phases. So I think that a lot of people's concerns and issues that they've raised have been addressed by the state, maybe not in the quickest of timeframes, but we're there.
I just want to say that logistically, this has been probably the biggest project that we've ever worked on together. And we're talking about it every single day, 7 days a week. We're always talking about this, and we're going to be able to pull this off. I think that people should feel confident that all of us together, we've been, as Michael said, the task force has been going on for over a year right now. We're ready to go. We get the vaccine from the state. We're ready to go. We're going to get as many people done as we possibly can. People should feel confident. That's all I have.
Thanks, Chief. Chief Tavares?
Yeah, I'll just echo that. Obviously, a lot of time, energy, and effort has gone into this, and I commend the people that worked on it. It's been a long process, but planning started a long time ago. And I know everybody's different, but my personal experience and Chief Hocking's personal experience with the vaccine, we got our first shot Wednesday. It'll be 2 weeks ago, and although everybody's different, neither one of us had any side effect. And I look forward to February 10th to get my second shot. So those that are considering it, I know that different people have different responses, but I was pleased with no side effects.